So now that our area is slowly going back to a new normal, families are enjoying the outdoors, travel, sports, and more. While summer months are filled with fun and create lifelong memories, it's also considered one of the busiest times in the ER and at trauma centers. Dr. Rachel Haley of HCA Midwest Health explains what precautions you can take to keep your family safe and to avoid the ER. Let's start with the danger that most parents do not think about often until a tragedy happens: pool and lake safety. So the season, it's just starting, but usually summer brings injuries and tragic drownings.
That's right. And when things don't go right in the water, typically they happen quickly. In fact, drowning is often silent, and it only takes seconds for a child or adult to drown. But we can help change that by keeping in mind some simple tips. One, drownings often occur when kids aren't expected to be swimming or when they have unanticipated access to water. Also, toddlers and kids in general are naturally curious and most at risk for drowning. That's why parents must use strategies like pool fencing and door locks. The highest rate of drowning is in children aged newborn to 4 years. Most infants drown in bathtubs and buckets, whereas most preschool-aged children drown in swimming pools. The next high-risk group is in adolescents, teenagers, or young adults, and many times this is influenced by alcohol or diving in shallow water.
So what are some of the latest recommendations for child water safety from the American Academy of Pediatrics?
Consider swim lessons for kids starting around age 3, and talk with your pediatrician about whether your child is developmentally ready for swim lessons. But even the best swim lessons can't drown-proof a child, so take steps to make a child's environment around water as safe as possible, like making sure they wear U.S. Coast Guard-approved life jackets when near water or swimming. And remember, floaties are not safety devices, a noodle is not a life jacket, and water wings are not a life jacket. And also inner tubes are not life jackets.
One of the other favorite outdoor activities, especially during the pandemic, has been camping, glamping, and RVing. Campfires and fire pits are part of that experience, but I have had friends who suffered burns. Are those common?
Campfire accidents send thousands of people to emergency departments each year, with young children being the most commonly injured. Injury often occurs when the family is setting up camp and children are left unattended. Children are attracted to fire pits, which can still be hot from previous campers. Fire pit embers can remain hot for 12 to 14 hours after the fire has been put out. So we recommend keeping water handy and always put out the fire before you go to bed and before you leave the campsite.
And like you, I have been so tired of this rain, but let's face it, our yards do love it. As a result, most lawns are green and they're ready for mowing. How young is too young for kids to mow?
We recommend not letting children under the age of 12 use a walk-behind mower and not allowing children under the age of 16 to use a riding lawnmower. Never let a child use a lawnmower without proper closed-toed shoes. And it's no longer considered a fun ride on the lap treat with the kids and adults. In fact, lawnmowers are the #1 reason for amputations, and each year many children are severely injured by lawnmowers.
Hard to believe it, but we are already talking about fireworks. As much as kids and adults love them, we know the risks. So what are some tips for fireworks safety?
Leave fireworks to the pros, especially since they are illegal in most suburbs and cities in the KC area. But if you are going to engage in firework activities, a responsible adult must supervise. Never give fireworks to young children. Even a sparkler can be dangerous. They burn at temperatures ranging from 1200 to 2000 degrees, hot enough to melt some metals. Always have a bucket of water or a water hose nearby, and dispose of used fireworks by wetting them down.
And those are all great tips and reminders from Dr. Rachel Haley. Now let's all stay safe and healthy this summer. For more information, just go to hcamidwest.com.